computer. There we go. Hi, this is Dr. Rogu from RBK Pediatrics. Another month passed by with another medical student from NICOM. And today I'm going to let my student Jacob, Dr. Jacob, present to you what to expect in the first years of life of your baby during the first years of the doctor visits. We had a lot of experience this month with Dr. Jacob, and Dr. Jacob just had a little baby, so it was very informative for him with real life experience, not just reading textbooks. So Dr. Jacobs, why don't you tell us what you learned?
All right, thank you, Dr. Rogu, for having me this month. If you're a parent today and you're here watching this, I want to say, first of all, that you made a great decision by designating RBK Pediatrics as your pediatrician. But so this presentation is really just meant to give you an overview of what that first year of doctor's visits is going to look like, a little bit about what to expect in your child's development in that first year, and a little bit about what to expect in terms of what vaccinations they're going to receive. And we're also going to talk a little bit about safety. And again, my name is Jacob. I'm a third-year medical student at NYIT. So just a quick overview of the visits. You're going to be seeing us, or your pediatrician, at 2 weeks, 2 months, 4 months, 6 months, 9 months, and 12 months. And in each of these visits, you're going to have a designated list of milestones and other things that we're going to talk about, like vaccinations. So for an overview of those milestone categories, in speaking of the development of your child, we're going to ask about certain milestones. And they're going to expect to be hitting these milestones at around a given age. And the general categories that we're going to talk about are the social and emotional milestones, their language and communication milestones, their cognitive milestones, such as learning, thinking, and problem solving, and then their movement or physical developmental milestones. And it's important to note that if your child misses 1 or 2 of these milestones, that's perfectly normal. That happens all the time where, they might miss 1 or 2 milestones for the given age category. But we only start to become more concerned when a child misses several milestones and really starts to fall behind in their age category. Here's just a quick picture of what the overview of the vaccinations is going to look like, just as a quick roadmap. We're only going to be covering up to the 12-month visit, which is about halfway in this picture, but it's just a good idea, just good to get an overview. Well, we'll go more in depth on it. So like I mentioned, the first visit is going to be at about 2 weeks of age. And we're going to talk about, with your pediatrician, the perinatal history and the birth history. So we're going to want to know were there any complications or any infections during the pregnancy? Did mom take any medications during the pregnancy? Was there any drug use or alcohol use during the pregnancy? And was your doctor concerned about things like your prenatal screening labs, HIV, syphilis, hepatitis B, and group B strep? And as far as the newborn screening at the hospital, we're going to bring, that's something that they do at the hospital that you're going to bring to us to review those documents. And you're also going to be able to tell us about any new medical issues or concerns that you might have as a parent. For the nutritional guidance, so common questions come up as to breastfeeding versus formula feeding. And we say that typically breastfeeding is the recommended route, but obviously this is not always possible because, the mom can't always breastfeed for various reasons. But if you are breastfeeding, breast milk should be supplemented with 400 units of vitamin D. Formula, however, does not require vitamin supplementation. So if you're formula feeding, you don't have to add those vitamins. Is really all that means. And formula, if you're feeding formula, as you probably already know, it comes in ready to feed or powdered. And at this 2 weeks of age, babies are not yet ready for other foods. So we're really only giving them that breast milk with vitamins or the formula. And we'll start to talk about other drinks and foods at around 6 months. Oh, and also for the weight, by the 2-week visit, we expect them to be, by the 2-week visit, we expect them to be back to their birth weight. So it's very possible, and we often see that babies will lose a little bit of weight after after being born. So they'll start at, let's say, 6 pounds, and then a couple days or a week later, they'll be at, a little less than 6 pounds, like, I don't know, 5 pounds, 12 ounces. But by 2 weeks is when we really want to see them at least back to that initial birth weight. And now safety is obviously a big thing. So safety at 2 weeks, one of the first things that we like to talk about is sleep safety. So this is usually talked about before leaving the hospital, and it helps to prevent against SIDS, or sudden infant death syndrome. Big scary thing, but basically the mnemonic is the ABCs of safe sleep. So first, you want your baby sleeping alone, meaning that they're not in your bed with you. B, meaning that they're going to be on their back. So babies shouldn't be sleeping on their tummies or on their sides. The back is the safest. And then C is for crib. And another thing I like to add is also not to have any loose items like blankets or anything that can get pulled up by the baby and cover their face up and, God forbid, cause suffocation. Pacifiers, we get questions about. Pacifiers are fine, and they've actually, some studies shown that they were able to reduce, they have an association with reduced risk of SIDS. So the pacifier doesn't count as a loose item in the crib. A little more on safety. So for another piece of safety that you probably were talked with before leaving the hospital, but we like to go over as well, is the use of car seats. And here's another mnemonic. So it goes backwards is best, the 20, 40, 80, and then boost until big enough. So what does that mean? So backwards is best means that the infant's car seat should be facing backwards towards the rear of the car, because that's safest in a head-on crash. And then 20, 40, 80 refers to children needing to transition in their seats when they hit 20, 40, and 80 pounds. And then lastly, boost until big enough is just saying that even when they're out of their regular car seat, we recommend using a booster seat until they're big enough to be protected by a regular seatbelt. And then at the 2-month visit, we're going to talk here. Is the first time we're going to start to see those milestones that we mentioned. So for the social or emotional milestones, the first thing that we want to see is they're able to calm down. And that means when we speak to them or we pick them up, the baby calms down. They should be looking at your face. They should seem happy when you walk up to them or walk up to the baby. And they should smile when you talk to them. And then for the language and communication milestones, the baby should make sounds. And those are sounds other than crying, obviously. We don't really count crying as making a sound because they all do that. And then they should also react to loud sounds. So we see the startle reflex if there's a banging noise or something that startles them. For cognitive milestones, the baby's going to watch you as you move specifically, and they're going to look at a toy for several seconds. And then for movement and physical development milestones, the baby is going to start to hold their head up when they're on their tummy. I'm sure many of you have heard of tummy time. So we recommend having the baby on their tummy for a little bit, just so they can develop those muscles needed to lift up their head. They should also be able to move both of their arms and legs, and they should be able to briefly open and close their hands. And then as far as vaccinations at 2 months, here's just a quick list of the vaccinations. So we have the Hep B second dose, the rotavirus first dose, the diphtheria, tetanus, and acellular pertussis, which is a mouthful, but it's, we just say DTaP. The Haemophilus influenza type B, or Hib, first dose. The pneumococcal conjugate, or PCV13, first dose. And the inactivated poliovirus, or IPV, first dose.
Jacob, did you see during your rotation any children with these diseases?
Well, luckily, due to these vaccines, these diseases have become increasingly very rare.
Right.
We barely even see, ear infections caused by some of these viruses. And I'll quickly talk about, at least on this slide, the first three of those vaccines: the Hep B, the rotavirus, and the DTaP, and a little bit about why we give those first three, and then we'll go over the other ones later. So for Hep B, it's the vaccine protects against hepatitis B virus, which is transmitted through body fluid, and it can lead to scary but chronic hepatitis, which is liver inflammation, liver cancer, and even death. So we give this vaccine to babies specifically if we think that their mom might have the virus, but it's also, we still give it to all babies. And then the rotavirus prevents against gastroenteritis, which is just basically the stomach virus. And the reason that's so dangerous is because that can lead to severe diarrhea and dehydration, which obviously we want to avoid. And then the DTaP, that prevents bacterial diseases such as diphtheria, tetanus, which is colloquially known as lockjaw, and pertussis, which is known as whooping cough. So these different bacteria lead to different things. For example, tetanus can lead to painful muscle spasms, seizures, paralysis, and even death. Pertussis, which is known as whooping cough, and many of you have heard of that. It has the initial symptoms of basically a regular cold, like runny nose, sneezing, a mild cough, but the cough will eventually progress to be more severe, and they'll go through these coughing fits. And when they're trying to breathe, you'll hear a characteristic whooping sound. Yeah, and a little more about safety at 2 months. We talked a little bit about car seats and how they should be sleeping, but another important thing is we want to really try to avoid any accidental injuries. And one big thing that we talk about is babies should never be left alone in the bathtub, for example, because they can drown even in the smallest amount of water, and I mean inches. So parents should avoid leaving them even not just near the bathtub, but any large open containers that a baby might fall into, even cleaning solutions. The other thing is parents should apply sunscreen if the baby is going to be outside on any sun-exposed areas. And speaking of burns, the other thing that we tell parents is to try to avoid drinking coffee while you're holding the baby. It's not unheard of for people to accidentally spill that boiling hot coffee while they're drinking it right onto their baby and God forbid, severely burn them.
The sunscreen should be a little bit later, at about 6 months of age.
Oh, okay.
Yeah. So they should use sun protection, I guess, like a hat or a towel or an umbrella or something over the stroller so the sun doesn't directly hit the child. Sometimes in the cars, they have those shades in the windows. That helps with the sun protection.
Got it. All right, so the 4-month visit, a little bit about those milestones that we can expect to see. So again, we have the same categories, but the social and emotional milestones, we're going to start to see the child smile on their own to get your attention. They're going to chuckle, and by chuckle, it's not really a full laugh, but it's more of like, obviously it's just a chuckle. Also, they're going to look at you and move or make sounds to try to get your attention. And then for the language and communication milestones, might make sounds like ooh or ah, like cooing sounds. And they're going to make sounds when you talk to them. And we want to see them turning their head towards the sound of your voice when you're talking to them, or just talking in general. For the cognitive milestones, we want them to open their mouth for a bottle when they're hungry and they see a bottle, for example, they're going to open their mouth. If they see a breast and they're expecting to be fed, they'll open their mouth. They're also going to look at their hands with interest. They're going to be curious about their hands. And then for the movement and physical development milestones, we want to see them holding their head up steady. And that means holding their head without support, right? They're able to hold their head up when you're not holding their neck for them. And They're going to be able to hold a toy when you give them a toy. They're going to be able to use their arms to swing at toys and reach for toys. They're going to bring their hands to their mouth. And they're going to be able to push up onto their elbows and forearms. So vaccines at 4 months. These are pretty much the same vaccines that we just talked about at the 2-month visit. But here now they're getting their second dose of most of these vaccines. And because we talked about a bunch of the vaccines before, I'll just quickly go over the last 3 vaccines that we didn't talk about. So the Hib prevents against Haemophilus influenza type B, which is another invasive disease. And before the vaccines were available, it was actually a leading cause of bacterial meningitis among kids. And what is meningitis? It's an infection of the tissues covering the brain and the spinal cord, and it can lead to long, God forbid, lasting brain damage and deafness. It can also cause Hib can also cause pneumonia, severe swelling in the throat, infections of the blood or the joints or the bones, and even of the heart itself. And obviously the Hib vaccine will prevent against these things. And then the PCV13 is meant to prevent against disease caused by 13 different types of the bacterium known as strep pneumo or Streptococcus pneumonia in children. And strep pneumo can cause infections of the blood, middle ear, so like ear infections that we talked about, right? We're not seeing as much of that due to this vaccine. It can also lead to infections of the covering of the brain and the spinal cord. And then lastly, poliovirus vaccine, IPV. I'm sure many people have heard of polio, and polio can affect infants as young as 6 weeks of age. And that one is a pretty serious one. It can lead to paralysis or even death. And for the 6-month visit, again, same categories of milestones, but we're expecting to see slightly different things in each category. So for their social and emotional milestones, they're going to be able to know familiar people. They'll recognize them. They'll look at themselves in a mirror, and again, they'll laugh. And then for the language and communication milestones, they'll take turn making sounds with you. They'll blow raspberries, which is basically they stick out their tongue and they blow. I'm sure you'll know what it sounds like when you get to it. And they'll also make some squealing noises. And for their cognitive milestones, they'll put things in their mouth to explore them. Kids are start to get very oral at this age. So, this is another safety thing. Watch what they're putting in their mouth. Watch what we keep. We want to watch what we keep around them. We don't want to keep open medications around them or anything that they might choke on, things that could be dangerous for them to put in their mouth. They also reach to grab a toy that they want to grab. They might close their lips to show that they don't want any more food. And then for their physical development milestones, they can now start to roll from their tummy to their back. And this is another safety issue that we want to make sure that we're not leaving them on any unattended on any tables or any high up places that they might roll off of, God forbid, because that's another common injury that we sometimes see. And then they can also, at this point, they can push up on their arms with their arms straight while they're on their tummy, and they can also lean on their hands for support.
Falling off of beds and couches and things, we did see a couple of kids with that in the office.
Yeah, and it's and it's a tragedy or an injury that can be avoided if you think about it. So back to vaccinations at 6 months. So here we're going to be getting the 3rd dose of a lot of the things that we talked about. The Hep B 3rd dose, the DTaP 3rd dose, the PCV13 3rd dose, the rotavirus 3rd dose, the Hib 3rd dose, and now is when we can start to also vaccinate against influenza or the flu. They can start to get their flu vaccine at 6 months. So for their 9-month visit, again, we have the same categories. So for their social and emotional milestones, we try to see, are they shy around strangers? Are they clingy or fearful around strangers? These are all normal things. Are they showing facial expressions like happy, sad, angry, and surprised? Are they looking at you when you call their name? Do they react when a parent leaves the room, and that their reactions might be like looking for the parent, reaching for the parent, or obviously crying? And then last is like, are they smiling or laughing when you play peekaboo with them, right? Do they understand peekaboo? And then language and communication milestones. Can they make different sounds? And these are going to be sounds like mama or baba or dada. And now that is when they're going to start to lift their arms to be picked up by their mom and dad. And then their cognitive milestones. If an object gets dropped out of their sight, like, let's say they're playing with a toy and they drop it, are they going to be able to look for it? Are they going to look for it? They're going to bang things together, again, like toys or two blocks, they'll bang them together. And then for their movement and physical development milestones, now is when they're really going to be able to sit. And by that, I mean, they're going to be able to get into a sitting position by themselves and sit up. They're also going to be able to move things from one hand to the other. And they're going to be able to use fingers to kind of rake food towards themselves. And like we said, they're going to sit without support. And for the 12-month visit, we have more of the same milestones. So now is when they're going to be able to start to play games like pat a cake. And then for the language and communication, they're going to be able to wave bye-bye. They're going to call a parent, mama, dada, or another special name in reference to those parents. And they're going to start to understand no. And by that, I mean, let's say they're doing something and you tell them no, they're going to, start to pause and realize that maybe they're not supposed to be doing that. And then for the cognitive milestones, they should be able to put things in a container, like putting a block in a cup. They're going to look for things that you hide. So if you put a toy under a blanket, they're going to look for that toy. And then for the movement and development milestones, they're going to be able to start to pull up to a stand, meaning, they're on the floor and they're able to pull up onto something to stand up. And they'll also be able to walk when they're holding onto furniture. They can also drink from a cup without a lid. So this is really, you as the parent can give them a cup with an open lid and kind of feed them the drink. And then they should also be able to grasp things with their thumb and pointer finger, like a little bit of food. And yeah, that's it. So thank you guys for listening to us. This little picture on the left-hand side is my son, Avery. He's now 1 month old. So, this presentation is was great for me too, because I was able to look ahead at what to expect.
And you got a lot to expect, let me tell you. All right, Jeffy, thank you for everything. And have a good day. And hopefully somebody will see you in the future as their doctor, and you will make one fine doctor for sure.
God willing. Yeah, especially with a great mentor like you. Thank you, Dr. Rogu.